of the neck. It's about the anatomy of the neck, what we have in the neck. So first, we must know what is the neck. What is the definition of the neck? Okay, so the neck is the The neck is the part of the body. It's a part of our body on many vertebrae. What is the function? It's connect the head to rest of the body, and it's provide the mobility and movement of the head. So the mobility and movement of the head is provided by the neck. So head can move it, flex it, turn it around. It's doing by the using of the neck. About the function of the neck. The neck, what is the function? The function is support the weight of the head and also protect the nerve that carries sensory and motor information from the brain down to the rest of the body. So its function is protect the nerve that comes from the brain down to the rest of the body. And this nerve, as you know, these nerves that carry the sensory and motor supply of the body. Also, the neck is highly flexible. We have the flexibility, that this flexibility allows the head to turn and flex in all directions. So this is the definition of the neck and its function. So its function, it's support the weight of the head and protect the nerve that carry the sensory and motor supply. And also, in addition, the neck is highly flexible and allow the head to turn and flex in all direction. And about the definition, it's a part of the body that connects the head to rest of the body, and it contains many structures and provide the mobility and movement of the head. About the boundaries, it means hudud, from where to where we call neck. The superior, from superior, above, what we have the inferior border of the mandible, the angle of the mandible, the tip from the anterior. From posterior, what we have the tip of the mastoid process. We have the sternocleidomastoid line in the posterior side, and we have the external occipital protuberance. So from above, what we have this landmark from anterior and posterior. From anterior, we have the inferior border of the mandible, angle of the mandible, and from posterior, we have the tip of the mastoid process, superior nuchal line, and external occipital protuberance. This is the hudud of the neck from above, from the superior. What we have in the inferior, it extends from where to where. So it extends superior from that structure that I say, and inferior is the insertion point, which is the jugular notch in the anterior side, sternoclavicular joint, superior border of clavicle, acromion, and from behind, from the posterior, it extends to the spinous process of the cervical vertebra C7. This is the boundary, the hudud, the origin and insertion point of the neck. from where to where it's extended. Okay, this is the hudud of the neck. So this is the neck. What we have about the surface anatomy, we have the larynx, we have the trachea, we have the thyroid gland. About the anterior region of the neck, so here we have the anterior region of the neck. The thyroid cartilage of the larynx formed a bulge in the midline of the neck called the Adam's apple. This is that I discuss about is about the surface anatomy. When you look at the neck, what you see, okay? So the surface anatomy, what we can see when we look at the neck of our friends, okay? The thyroid cartilage of the larynx form a bulge in the midline of the neck called the Adam's apple. So the Adam's apple, it's more prominent. You can feel it. You can see this prominence from the surface. The Adam's apple is usually more prominent than men. So the Adam's apple of the female and male, it's different. The Adam's apple, it's more prominent, more clear in the man than woman. Inferior to the Adam's apple is the cricoid cartilage. So below the thyroid cartilage, we have the cricoid cartilage. Extended, after that we have the trachea. The trachea is traceable at the midline, extending between the cricoid cartilage and superior suprasternal notch. From the lateral aspect, what we have the Sternocleidomastoid muscle. Is the most striking mark. It separates the neck into two parts: anterior triangle of the neck and posterior triangle of the neck. Just a minute, student. آلاء خالد. آلاء. This is the surface anatomy of the neck. We have the hyoid bone, we have the thyroid cartilage, we have the cricoid cartilage, and the important one, the sternocleidomastoid muscle, is the muscle from the lateral aspect of the neck. Okay, I put the important things in the red box. So the red box structures, it's very important for the final exams. Okay. So in this picture also you can see the hyoid bone, a U-shaped bone with two horns. and you can see the thyroid gland with its two lobe, left lobe and right lobe. Now we reach to the compartment or component of the uh, compartment or component of the neck. What we have in the neck, when you cross section of the neck, and when you look at the neck from above, what you see, you can see this structure, important structure. You can see the visceral part in the yellow. We have one visceral part. We have one vertebral compartment, and we have two vascular compartments in the right and in the left. So the neck structures are distributed within four compartments. The vertebral compartment in the center and in a white color. What you see, it's contain the cervical vertebra. So in the center of the neck, what we have the cervical vertebra with the cartilaginous disc between each vertebral body. And also the spinal canal bounded to the vertebra, and this spinal canal is the home to protect, and it's a portion for the spinal cord of the neck. Okay. Visceral compartment accommodate visceral compartment. We have the yellow one. The yellow one is the visceral compartment. The visceral compartment is the trachea, larynx, pharynx, thyroid, and parathyroid gland. So the yellow one is the visceral compartment, which is composed of the trachea, larynx, pharynx, thyroid gland, and parathyroid gland. These two sheets, vascular sheet here in the right and in the left, is the carotid sheet. The carotid sheet is a paired. Paired, it means we have the right and left. It consists of two carotid sheets found in each side of the trachea. The content of the carotid sheet is very important for both nasally and amali. Okay, so for the exam of nasally and amali, both of them, the content of carotid sheet is very important. Keep in your mind and pay attention for the carotid sheet component. Each carotid sheet contains the vagus nerve, common carotid artery, internal carotid artery, and internal jugular vein. These are the most important component of the carotid sheet. Skin of the neck. The nature of this line of the cleavage of the skin are constant and run almost horizontally around the neck. Here also we have the you can see the internal carotid artery. You can see the external carotid artery. You can see the common carotid artery, and you have the external jugular vein and internal jugular vein, and thyroid gland and trachea. These are the important structure that you can see on the lateral aspect of the neck.
دكتورة دكتورة
Yes, نعم.
دكتورة الصوت مو واضح.
صوتي مو واضح؟
ايه دكتورة؟
هسه شلون؟ hypoglossal nerve, common carotid artery, left vagus nerve. It's okay?
واضح.
Okay. So here also I put the important structures in the red box. In the red box, what we have in the yellow one is the hypoglossal nerve. We have common carotid artery. We have the left vagus nerve and left recurrent laryngeal nerve and trachea. Why we say the left vagus nerve and right? Because it's the component of the carotid sheath. So in the right side and left side we have it. Also we have the left and right recurrent laryngeal nerve. This picture is so important for the exams.
دكتورة يعني هذا البلود سبلاي of the neck.
No. It's the
عشان
important it's the important structures that you can see when you cross the طبقات أولية of the neck. It's the nerve supply, artery supply, the vascular supply, all of them, okay? It's overall. You can see these important structures. It's not about just blood supply, okay? All about the structure that present in the neck. Is it clear?
تمام دكتورة.
Okay. About the cutaneous nerve and superficial vein, what we have the lesser occipital nerve. The lesser occipital nerve, also known as the small occipital nerve, you can see is a cutaneous branch of the cervical plexus. It innervated the skin of the neck and scalp posterior and superior to the auricle. Also, you can see the greater auricular nerve, and you can see the external jugular vein. You can see the transverse nerve of the neck or transverse cervical of the neck. About the triangle of the neck, we have two triangles, anterior triangle and posterior triangle. The triangle of the neck are very important. Why? Because it contains the very important structures. So they houses all the neck structures, including glands, nerve, vessels, lymph node. Okay, so why we talk about the triangle of the neck? Because as I say, we have the important structure inside this triangle, like gland, thyroid gland, the nerve like vagus nerve, the vessel like internal carotid artery, and a deep cervical lymph node present in this triangle. For that reason, we talk about the triangle of the neck. So what is the triangle of the neck? This quadrilateral space is divided by the sternocleidomastoid muscle into two main triangles. The sternocleidomastoid muscle passes obliquely upward and backward from its side of origin. It has two origins. Look, this muscle is the sternocleidomastoid muscle. It has two origins here, clavicle and sternum of the chest, and have one insertion point here. The insertion point is the mastoid process of occipital bone. As you know, the occipital bone have a prominency. It's called the mastoid process. This process, if you put your finger behind of your head, you can feel it, the projection of the mastoid process. So the insertion point of this muscle is the mastoid process. The triangle in front of this muscle is the anterior triangle, while behind of it, it's the posterior triangle. So here we have the sternocleidomastoid muscle. The anterior to it, it's the anterior triangle, while the posterior to it, it's called the posterior triangle. So this one This is the sternocleidomastoid muscle here. The anterior to it is the anterior triangle, while the posterior to it it's the posterior triangle. So what is the boundaries, حدود of the anterior triangle? The anterior triangle, inferior border of the sternocleidomastoid muscle, midline of the neck, inferior border of the mandible. So here, what is the حدود of anterior triangle? We have the inferior border of the mandible here, inferior border of the mandible, midline of the neck, here midline of the neck, and anterior border of the sternocleidomastoid muscle. This muscle I say sternoclavicle mastoid process, sternocleidomastoid muscle. So this is the حدود in a green color is the حدود and boundary of the anterior triangle. This triangle also subdivided. Here also we have the big triangle in the right and in the left. The base is upward and the apex of the triangle is downward. What is the حدود and boundary? The inferior border of the mandible, the midline of the neck, and anterior aspect of the sternocleidomastoid muscle. Okay, so this one also in the gray color, what we have the anterior triangle as a surface anatomy. It's if you see, we have a broad base formed by the inferior border of the mandible, and we have the apex here to the jugular notch. We have the sternocleidomastoid muscle, the anterior region. We have the midline of the neck and inferior border of the mandible. This is the حدود and boundaries of the anterior triangle. This anterior triangle subdivided into four small triangles. What we have the submental triangle below the chin. We have submandibular triangle below the mandible. We have the carotid triangle, and we have the muscular triangle. This one. Submandibular below the mandible, submental below the chin, carotid, and muscular triangle. Now we talk about each of them, about the boundaries. Okay? So before starting the boundaries and حدود of these small triangle, we must know about the name of the muscles, because the muscles formed the حدود of this small triangle. What we have, the green color muscle is called the digastric muscle. This digastric muscle is two parts, the anterior belly and posterior belly. Anterior belly and posterior belly. Also, this blue muscle is called Homohyoid muscle. Homohyoid muscle. This Homohyoid muscle also have two parts, superior part and inferior part. If you know the exact name of these two muscles, these three muscles, after that the boundary, the حدود of this triangle becomes so easy. So here we have the digastric muscle, the anterior belly and posterior belly. Now, what is the boundaries of the submandibular triangle? It's formed by the inferior border of the mandible here, inferior border of the mandible, anterior belly of digastric muscle, and posterior belly of digastric muscle. So submandibular, the triangle that below the mandible, what is the حدود of it? Is the inferior border of the mandible, anterior belly and posterior belly of digastric muscle. About the here, about the submental triangle here, submental triangle, what is the boundary? It's formed by the midline of the neck, here, midline of the neck, anterior belly of digastric muscle, and the hyoid bone. Here we have the hyoid bone. So the hyoid bone, the anterior belly of digastric muscle, the midline of the neck, it's formed this green triangle, small triangle below the chin, which is called the submental triangle. We have the carotid triangle, very important triangle. What is the boundary? As you know, this big muscle is the Homohyoid muscle. This Homohyoid have two parts, the superior belly and inferior part. So here, the boundary of carotid triangle is formed by the superior belly of Homohyoid muscle, by the Sternocleidomastoid muscle, and it's by the posterior belly of digastric muscle. So posterior belly of digastric muscle, superior belly of Homohyoid, and Sternocleidomastoid muscle, forming the carotid triangle. We reach to the muscular triangle here, muscular triangle. What is the boundary حدود? It's formed by the midline of the neck, superior belly of Homohyoid, here superior belly of Homohyoid, and Sternocleidomastoid muscle. It's so easy, so easy if you just know the name of the muscle. Which muscle? Homohyoid muscle and digastric muscle and sternocleidomastoid muscle. Okay. So this is the anterior triangle of the neck. I put the red color on it. Anterior triangle, it's very important. Submental, this one, this dark green. Submandibular, light green here. Carotid triangle, yellow one. And purple one is the muscular triangle. If you notice, we have the anterior and posterior digastric muscle. We have the superior and inferior belly of Homohyoid muscle. Also, we have the sternocleidomastoid muscle. All this triangle, it houses for very important structures. What we have in this anterior triangle, the important one, we have here, we have the external jugular vein, we have the internal jugular vein, we have the common carotid artery, we have the phrenic nerve, we have the vagus nerve, we have the thyroid gland. Also, we have more important structure, but in this picture, we can just see at these important structures. Okay? This triangle, the carotid triangle, we talk about it. This also show the small triangle, sub-triangle of the anterior triangle in a different color, okay, for more clearance. Here, carotid triangle, as I say, what is the boundary? It's bounded by the posterior belly of digastric muscle and superior Homohyoid and sternocleidomastoid muscle. This one is the carotid triangle. What is the component of the carotid sheath? Carotid sheath is component of the carotid triangle. It's very, very important for both nazari and amali, practical and theoretical. Okay, for the exams. Why? If you put your finger on the lateral side of the neck, you can feel the pulsation of the carotid artery. It's the sign of the life of the person. So if you cannot feel this pulsation, it means the person it doesn't have life. It doesn't stay alive. Okay, because you must feel the pulsation of the carotid artery, the sign of the life of the person. The carotid sheath content it's very important for you as a dentist. Okay. So what we have the common and internal carotid artery, we have the internal jugular vein, we have the vagus nerve, we have the deep cervical lymph node, okay? We have the sympathetic nerve fiber. But the most important one is the common carotid artery, internal jugular vein, and the vagus nerve. Here, this is the component of the carotid sheath. This one is the carotid sheath. This one the carotid sheath. Okay, this one the common carotid artery. Common carotid artery. This blue vein structure vessels is the internal jugular vein. This big yellow color nerve is the vagus nerve. Also, we have the sympathetic trunk. So I put the most important structures in the red box. This red box it's very important for the final exams. Here, what we have it's the component of the carotid sheath. What we have the internal jugular vein, this one, internal jugular vein. We have the sympathetic trunk. This big nerve, very important nerve component of the carotid sheath is the vagus nerve. Okay. Also, we have the phrenic nerve. It's also very important. This phrenic nerve, it comes down lateral to the carotid sheath. So we reach to the posterior triangle. It's a triangle that is placing on the posterior of the sternocleidomastoid muscle. So it's formed by the sternocleidomastoid muscle anteriorly, the trapezius muscle, it's posteriorly, the clavicle inferiorly. The apex of the triangle is formed by the occipital bone. I talked about now. Here, as you see, here we have the anterior triangle. The base is up, the apex is down. While here for the posterior triangle, the base is down and the apex is up. It's vice versa, بالعكس anterior triangle. Okay, so what is the boundary? It's formed by the sternocleidomastoid muscle, by the trapezius muscle, and by the clavicle. Clavicle here, we have the bone of the shoulder, its name is clavicle. Okay, this big muscle in the behind of the neck, it's called the trapezius muscle. Trapezius muscle, okay. So anteriorly, it's formed by the posterior border of the sternocleidomastoid muscle. Posterolaterally, anterior border of the trapezius muscle. Base is by the middle third of the clavicle. You're welcome. Middle third of the clavicle, and the apex is the meeting point of the sternomastoid, trapezius, and superior nuchal line. So this is the hudud of the posterior triangle. Here, all of them is the posterior triangle. Look, if you notice, it has the broad base, which is formed by the middle third of the clavicular bone. Here, we have the sternocleidomastoid muscle, we have the trapezius muscle, and we have the meeting point of the sternomastoid, trapezius, and the a superior nuchal line of the occipital bone. This posterior triangle divided into two parts, occipital triangle and supraclavicular, it means above the clavicle. So it's divided to two small triangle here, the occipital triangle, and a subclavian or supraclavicular triangle. Above the hudud and boundaries of the occipital triangle is formed by the inferior belly. Here, the red one is the Homohyoid muscle, the inferior belly of Homohyoid, the Trapezius muscle, this one is the Trapezius muscle, and by the Sternocleidomastoid muscle. Above the supraclavicular is formed by the inferior border of the Homohyoid, inferior belly of the Homohyoid, by the clavicle, and by the Sternocleidomastoid muscle. What we have in the posterior triangle, we have the very important structure, spinal accessory nerve, branch of cervical plexus, we have the brachial plexus. This is the component of the muscular component of the posterior triangle. This brown big muscle in the behind, we have the trapezius. This big green muscle is the sternocleidomastoid muscle. The dark blue is the splenius capitis. The yellow one is levator scapula. Here, this muscle is the group of muscle, scalene group. We have the anterior, middle, and posterior. Here, we just can see the anterior and middle scalene group. The posterior one is not clear. So this big muscle at the behind is the trapezius muscle. Here the scalene muscle, anterior, middle, and posterior. Okay. So anterior, middle, and posterior scalene muscle. We have the sternocleidomastoid muscle, two head, sternal head attached to the sternum of the chest, and we have the clavicular head attached to the clavicle. And here the insertion point, which is the mastoid process of the occipital bone. Here we have the digastric muscle, the anterior belly, posterior belly. Okay, these are the important muscle of the neck. So, do you have any questions? Do you have any question, please?